Why does vomiting happen with ulcers? Imagine your stomach as a busy factory, breaking down food and sending it along your digestive path. When an ulcer forms, it's like a small breach in the factory's wall, often caused by excess acid, pepsin, or infection with bacteria like Helicobacter pylori. This breach can lead to irritation and inflammation of the stomach or duodenum lining. When the lining becomes inflamed or damaged, it sends signals to the brain that can trigger nausea and vomiting as part of the body's way of protecting itself. This reaction is common because the body recognizes the injury and tries to rid itself of irritants or harmful substances. Another reason vomiting occurs with ulcers is due to a complication called gastric outlet obstruction. If an ulcer near the opening of the stomach causes swelling, scarring, or narrowing of the pylorus, the passage that leads to the small intestine becomes blocked. When this happens, food and stomach fluids can't pass through normally, so they build up in the stomach. This buildup causes the stomach to stretch and often results in recurrent vomiting of undigested food, sometimes in large amounts. It's like a traffic jam in your digestive system, forcing the contents back up. Ulcers can also erode into blood vessels, leading to bleeding. When this occurs, blood may be vomited up, appearing as dark, coffee ground-like material. This is a serious sign and indicates that the ulcer has caused bleeding within the stomach. Vomiting blood, known as hematemesis, requires urgent medical attention because it can lead to significant blood loss and other complications. Inflammation from ulcers can disturb the normal movement of the stomach muscles, affecting how quickly food empties into the intestine. This motility disturbance can stimulate reflexes that cause nausea and vomiting. Additionally, severe ulcer-related pain or complications like perforation, where the ulcer creates a hole in the stomach or intestinal wall, can trigger intense reactions, including vomiting, as the body responds to the injury. In essence, vomiting with ulcers is often a combination of the body's response to irritation, swelling, or bleeding caused by the ulcer. It can range from mild nausea to frequent vomiting of undigested food or blood, depending on how severe the ulcer and its complications are. If you experience vomiting along with symptoms of an ulcer, it's important to seek medical care promptly. Treatment usually involves medications to reduce stomach acid, eradicate any infection with Helicobacter pylori if present, and sometimes surgery if there is significant obstruction or bleeding. Always remember, consulting a healthcare professional is key to managing ulcers safely and effectively.